Good morning. So congratulations, you got your catheter removed. So that's the first step. And now we want to concentrate on your quick recovery. So there are a couple things that are important early on, and the recovery of the erectile function as well as continence is, I'm sure, very important for you. Okay, so for erectile recovery, we're going to target it in two ways. One is with medications, and the other is with what's called the vacuum erection device. So I usually recommend patients to take Cialis every night, a 5 milligram dose. It's very inexpensive now that it's generic, so you should be able to get it for about less than 50 cents per pill if your insurance doesn't cover it. Usually I recommend the community pharmacy or Costco, which is probably the cheapest of the pharmacies. Some patients can get it for $18-20 for the whole 30-day course. Okay, so take the 5 milligram Cialis daily, and I recommend taking a 20 milligram boost at least twice a week, but with stimulation. Remember that the medicine is not going to give you an erection unless you have sexual stimulation. So you need to have that and combine it with the pills. Now, I've found that Cialis is very well tolerated. Very few patients have to stop it because of side effects. Some patients may have some headache or flushing. Some patients may have back pain or muscle aches, but that's relatively rare. So if you have it, I would just stop it for a couple days. The medicine lasts a long time in the body, so it may take several days for you to wash it out. And then maybe try it again. Instead of every day, try it every other day and see how that goes. If you're still having side effects, then we can try, let me know, then we can try maybe sildenafil, which is Viagra, okay? Now, the other thing that I want to recommend is the vacuum erection device. This has been shown in many, many studies that helps recovery, okay? So it's essentially a suction device where you're going to introduce a penis here, and you're going to try to create an erection. Basically, the more you use it, the better it is for you. Okay, so for patients who are recently operated or patients who are in hormone therapy because they have prostate cancer, or patients who are undergoing radiation or underwent radiation recently. So use it or lose it. Basically, you need to be able to stimulate an erection, to have the penis fill with blood, so you avoid atrophy, so you avoid losing muscle in the penis. And it has been shown that patients who use medicines like sildenafil or tadalafil, which is Cialis, and use a vacuum device can preserve a lot more of the muscle of the penis when they're during the recovery period. So the other benefit of the vacuum erection device is that it comes with these bands that you can put at the base, and when you get the erection, then you can release it, and that can hold blood in the penis so you can support the erection. And if you have a good erection but you lose it very quickly, that it can help you maintain the erection longer. If you can't, then even if pills don't work, then you can use a vacuum for that. So I think that you should be optimistic and you should be very aggressive about the rehab using the pump and the pills early on, because the first 6 months are going to be critical. Okay, some patients say, well, I don't want to think about that right now and I'm just going to do it later, but that's really not the good strategy. The best strategy is to use the vacuum pump and use the pills as early as possible. And those are the patients, in my experience, the ones that recover early are the ones that are going to be most satisfied. So when you come back in 2 months with your PSA, we're going to see how you're doing. If you're still not having partial erections or the pump's not working for you, then we can talk about injection therapy, which is a medicine that you can inject yourself with a very small insulin needle at the base of the penis, and we can help you with that. So hopefully things are going to get better quickly, and look forward to seeing you in 2 months. Take care.